Nearly 4 million people each year in the United States will develop generalized anxiety disorder. It is more common in women than in men, and more common to develop during childhood and adolescence years, but may develop during adulthood. There are many risk factors associated with GAD, so you may be at risk even if you think you're not. By the end of this speech, you will be able to gain information about what it is, ways to prevent it, and some treatment options that are open. I have personally researched this topic to better understand what some of my friends are going through and what their lives are like living with the disorder. This disorder is not to be taken lightly because it can be prevented and treated. I will discuss and explain what GAD is, ways to prevent it, and some treatment options that are open for those who suffer from it. What exactly is generalized anxiety disorder? According to WebMD, generalized anxiety disorder is the constant excessive worrying and anxiety that a person suffers from about everyday events with no specific reason or cause for the worrying. Those who suffer from it may worry about events such as school, family relationships, relationships with their partner, or any other event that they suffer from each day. Those who suffer from it may have over-exaggerated or unrealistic worrying, but to them, it is not over-exaggerated or unrealistic. Causes, according to the National Institute of Mental Health, may include lots of stress, genetics, and the chemicals in your brain causing the anxiety levels to increase. Although these may be factors, there is no one specific cause for the disorder. There are a wide range of symptoms, including excessive worrying or tension for no apparent reason, irritability, headaches, muscle tension, and restlessness. These are some of the main symptoms that are attributed with the generalized anxiety disorder, but they are not limited to any other symptoms. Symptoms may get worse or better over time depending on the individual. Some individuals may have other anxiety disorders including panic disorder, depression, phobias, and obsessive compulsive disorder. Now that we have discussed what the disorder is, including possible causes and symptoms, here is ways to prevent GAD. The Mayo Clinic describes some of the ways to reduce warning signs and help prevent GAD from developing include get help early. If you believe you are at risk, please contact a doctor and tell them you may be developing the disorder. Manage your time and energy wisely so your anxiety levels don't increase, allowing for the development of the disorder. Avoid items that may contribute to an unhealthy lifestyle, such as substance abuse and alcohol abuse. If you feel like that you can't reduce these on your own, please contact a doctor so you can get the proper help. Finally, I will discuss 2 treatment options for those who have generalized anxiety disorder. The 2 treatment options include cognitive behavior therapy, which is a specific type of psychotherapy. This treatment option helps a person think, behave, and react differently to situations to help him or her have less anxiety and stress. The second treatment option is to be put on medication. The 2 types of medications that are most commonly used are antidepressants and anti-anxiety medication. These are generally used for short periods of time since they usually work right away for most people. There are side effects included with the medications, including headaches and nausea, although these side effects are not typical. The best option for you is to talk to your doctor to see which is best for you. Now that you have a better understanding of what generalized anxiety disorder is, ways to prevent it, and some treatment options, let us review the main points. Generalized anxiety disorder, according to WebMD, is having the constant excessive worrying and anxiety over daily tasks, most times not for a specific purpose or reason. Causes are unknown, but some factors may be associated with GAD are stress, genetics, and increased or decreased levels of some chemicals in the brain. Some symptoms, but not limited to, include headaches, excessive worrying for no reason, irritability, and tension. There are many ways to prevent GAD, including getting help early if you believe you are developing the disorder, managing your time and energy so your anxiety levels do not increase, and avoiding an unhealthy lifestyle, including substance abuse and alcohol abuse. The 2 most common treatments include cognitive behavior therapy, which will help reduce stress levels, and medication including antidepressants and anti-anxiety medication. The best option will be chosen for you by a doctor if you believe you are developing the disorder. Even though worrying and being anxious all the time is common in many people, GAD can be preventable. With the right information and tools given to you today in this speech, you may be able to prevent generalized anxiety disorder, help maintain it with a healthy lifestyle, and help you lead to a more fulfilling life.